And the second wave is shining a light on COVID-19 hotspots across the country, and regional differences means the public health approach differs from province to province, city to city. But is it time for a more consistent national framework? Was it discussed on yesterday's phone call between Ottawa and the provinces? Let's bring in a premier who was on that call. And joining me now is New Brunswick Premier Blaine Higgs. Hello, Premier. So nice to see you. As usual, thanks for being with us on this Friday afternoon. We have had some dire warnings today from the Chief Medical Officer, from the Prime Minister. Cases are going up across the country. We're a little bit jealous of your Atlantic bubble, but I don't want to be, I don't want to be dark, but we have seen cases spike and inexplicably. So it could happen in the Atlantic bubble. I'm just wondering, are you ready for that?
Well, certainly, Joyce, it's very concerning in watching what's happening in the rest of Canada, and I know the circumstances are different with the population, in the large cities, and it makes it much more difficult for my colleagues. We're very focused on our border control. We have been certainly between northern New Brunswick and the Quebec border, as well as on the U.S. border. That's been what we feel has been a big factor in our success to date, but we're very cognizant of the risks, and travel has been the exposure we've had. Our health authorities and quick action teams have done an admirable job, but yes, it's all around us, and it could certainly be is a factor and a concern here as well.
So I'm wondering, there have been, Justin Trudeau said today, 22 meetings with Ottawa, the premiers and Ottawa, the Prime Minister urging you to take action, perhaps not you, but mostly the premiers more concerned, Quebec, Ontario, and saying resources are finite. But if this gets worse, Ottawa will not be able to help as much as it is now. So there will have to be, he told us today, difficult choices to be made. Have you discussed with the premiers and with the Prime Minister what those difficult choices could be?
Well, it's always a balancing act, and we've had the discussions as an ongoing process in our meetings. But it's always a balancing act between trying to keep the economy open and keep people's lives as normal as possible. Our focus from the beginning is to try to maintain stability in our economy, and while at the same time ensuring that we're following the public health rules. And so it's that's worked well so far in the quick action from team members. But people in the province have been cognizant of the public health rules and have been following them closely. We monitor that. We do surveys. We do kind of spot checks all over the province. So I'm very pleased with the response to date. But I can't help but say that we are in a little different position, a little more sparsity of population, and so the size of our cities is much less. It gives us room to maneuver where others and my colleagues don't have that same luxury. So I'm very very cognizant of their situation, but we feel good about where we are right now, and our goal is to keep businesses open and allow our economy to continue to grow. And we're seeing good signs of that. I mean, we're seeing a lot of activity in our province right now, so it's encouraging. But every day is a new day. And I'm very, very cognizant.
But Premier, I'm wondering about those choices. You say you've discussed them with the premiers in a few, or if not all, of those 22 meetings you've had with the premiers and the Prime Minister. What are we talking about when they say, when the Prime Minister says difficult choices that he has spoken with you and your colleagues about? What are these choices?
Well, the choices are trying to exercise the balance of whether you stay open or whether you shut down hard. And we've seen certainly that other provinces have had to do that, and we have had to do it regionally. We haven't had to shut down hard since the beginning of the pandemic back in March, but we had to resort back into a couple of communities to an orange phase and do it for a period of a couple of weeks and 4 weeks, and then get back to what is yellow, which is relatively normal, but still following all the health rules. So that is the choice. And how hard do you shut down? We've seen what Manitoba's done just in this past week, and we've seen what Quebec has done. So there is that situation which my colleagues have to balance. Is it possible? Is it workable? And those are the discussions we've had federally because of their large cities and how do they manage it. But shutting down hard is one way to stop the spread, and you really are closing all avenues of kind of public activity.
So the federal government has put $19 billion on the table, told the provinces, help yourself. This is for COVID relief, mostly, I hope, for the healthcare system. Now, has it helped your hospitals? Because what the Canadian Medical Association is telling us is that doctors are not seeing the benefit of this money on the front lines. Have you been able to improve your hospital capacity? Have you been able to hire more people just in case? What have you been able to do with the money that the federal government has offered the provinces?
Well, certainly it's been spread in different ways. Like we've spent about $14 million on border protection alone, in having our authorities there watching the borders where certainly feel the need to do so. In the hospitals, providing the protective equipment and being able to provide all the materials that we need. But I guess, again, our hospitals have not been taxed to the level that we've seen elsewhere. So it's different here, but we have been able to, the federal government support, we've been able to meet the needs that have, we've
But
heard.
if, Premier, if you should have a surge, are your hospitals ready?
We feel we are. I mean, we have a lot of measures in place. We've done a lot of training. We're working well as the two health authorities, both Fatality and Horizon, have worked better together than I think ever in the past, and that's very encouraging for our province and our healthcare capabilities. So yes, we're ready. We don't know obviously quite what to how significant it could be, but at this point, it's been going okay, and our hospitals have been managing very well.
Well, that's good news. Blaine Higgs, New Brunswick Premier, thanks so much for sharing your thoughts with us. I wish you a happy and safe weekend, sir.
Thank you very much, Joyce. Same to you.